First see the sinus. See the sinus anterior expansion, downward expansion, posterior expansion. Here. So what they do is they divide the maxillary arch into 3 areas. Okay. The front is called Bedrosian classification. Okay. Second is this one. Third is this one. 3 circles. Okay. Where you have got good bone or no bone or less bone, this is a classification. Okay. Here the second circle is poor, right? The sinus is till the root apex. Here also the same, but we have got a good bone in the first circle. Third circle, pterygoid will always be present 100% for all patients, but whether it is good or not is a question. But here the sinus is gone now till here. Imagine if you place implant like this, it will penetrate the sinus and it will go. Here also the same. It is close to sinus. Okay. Even though we are getting stability from the pterygoid implant, if maxillary tuberosity bone is present, it will guide our implant. If sinus removes all the tuberosity, then it becomes a difficult situation. The stability becomes less. Placing implant itself becomes a difficult. So comparatively, if you see, even the pterygoid is challenging. The second segment is not good, but the first segment is good. So I was thinking, can we give implant and give one molar cantilever, right? So we will see each and every segment individually. First we will analyze this segment, this molar segment. Okay, is it possible to do something there? We will see the 1/6. So this is the mesial root of, okay. So this is the mesial root of 6. Okay. So remember this one, especially it will be very much useful when you are replacing only 6 or 7, not for full mouth. Okay. Immediately palatal to the mesiobuccal root, you will get bone. Okay.
Repeat again, sir.
Immediately palatal to the mesiobuccal root. Okay, there will be a bone. This part. We don't know how it is the length, but you will get bone. For upper 6 extraction and implant, you can use that bone. Unless there is some infection, bone loss. So we will measure this length here. It is around 8. Okay, it is around 8. But luckily, there is some amount of bone on the palatal aspect. Yesterday we discussed something called palatal bone. Usually it won't be there, but for him it is present. Say maybe the nature has given him no extra bone everywhere. If you can able to drill in this direction, which is tricky of course, then you can give almost 16 mm implant. If you go in this direction, you are reaching sinus floor, but if you go in this direction, you can reach nasal floor. You don't have to go till here also, even if you stop short, you can place a 3.75 implant decent. Analyze the distal half of the 6. So this is the palatal root. Palatal root is always a good site. 99% you will find good bone. What implant you will place? Implant, okay. Yesterday.
Basal.
Yes, basal what diameter?
5.5.
Yes.
5.5.
So 5.5, 5.5, 10 or 12 based upon the length only. But here, if you just tilt now and go here, you will get good bone. Okay. If you go along the palatal root, you are going here. Just slightly tilting and you may go here. Very rarely we can see such kind of palatal bone in 6. Usually we don't see.
Sir, in case of fabrication of a guide,
Yeah, you can do this.
the angulation will
It's
be
predetermined.
like this,
Yes.
so they'll design.
They will design a guide, then you can drill through the guide. Palatal bone is there, but it is very small. Palatal to mesiobuccal root. Just we are learning anatomy now. Now we are seeing the palatal root of 7. This is the palatal root of 7. See the bone loss here. We have good bone on the palatal side, but here, so the implant may not be stable because it needs 360-degree bone. Okay, we will see 8 now. It is not that much, it's a conical root. It is a conical root, it is not useful. Okay. So 6, 7, 8, 6 we have got good bone. We can place a good implant over the palatal bone area and we can stop it. There is no need to go till pterygoid. So pterygoid I will give you a